Today we are going to understand Tinea Versicolor, a very common superficial fungal infection of the skin. Although it is frequently seen in clinical practice, it is also a favorite topic in dermatology exams because of its characteristic appearance, simple diagnostic clues, and classic microscopic findings. Let us break this condition down step by step. First, let us talk about the causative organism and etiology. Tinea versicolor is caused by Malassezia species, particularly Malassezia globosa and related yeasts. Interestingly, these organisms are not foreign pathogens. They are actually normal commensal flora of human skin. Under normal conditions, Malassezia lives harmlessly on the skin surface as a yeast. However, when certain environmental conditions favor its growth, it overgrows excessively and transforms into a pathogenic form. The most important factors that promote this overgrowth are heat, humidity, and sweating. That is why Tinea versicolor is extremely common in tropical climates and during summer months. Another important mechanism involves azelaic acid, a substance produced by Malassezia. Azelaic acid inhibits melanocyte activity, reducing melanin production. Because of this effect, affected areas may appear hypopigmented, especially in individuals with darker skin tones. So, in simple terms, the disease occurs due to overgrowth of a normally harmless yeast under favorable environmental conditions. Now let us move to the clinical presentation and appearance. Tinea versicolor typically presents as discrete, scaly patches on the skin. These patches are most commonly seen on the trunk, chest, back, neck, and shoulders. One unique feature is that the patches can vary in color. They may appear hypopigmented, meaning lighter than surrounding skin, or hyperpigmented, meaning darker than surrounding skin. Sometimes they may even appear slightly erythematous, or reddish. Another hallmark feature is that these patches do not tan with sun exposure. When the surrounding skin becomes darker after sunlight exposure, the affected areas remain pale, making them more noticeable. The lesions are often associated with fine scaling, a feature known as pityriasis. If you gently scrape the lesion, the fine scales may become more apparent. This is sometimes called the evoked scale sign. Although the condition may look alarming cosmetically, it is usually asymptomatic. Most patients report minimal or no itching. Next, let us look at the diagnostic testing. In many cases, clinical diagnosis alone is sufficient because the appearance of the lesions is quite characteristic. However, there are a few diagnostic tools that can help confirm the diagnosis. One such tool is the Wood's lamp examination. Under ultraviolet light, the lesions may show a pale yellow-gold fluorescence. This can help differentiate it from other pigmentary disorders. Another commonly used test is the KOH preparation, performed using skin scrapings from the lesion. When examined under the microscope after potassium hydroxide treatment, the characteristic finding is clusters of yeast cells along with short hyphae. This pattern has a classic description often remembered by students as spaghetti and meatballs. The round yeast cells resemble meatballs, and the short hyphae resemble spaghetti strands. This microscopic appearance is one of the most well-known exam clues for Tinea versicolor. Now let us discuss the treatment strategies. For most patients, the first-line treatment is topical therapy. Commonly used options include selenium sulfide shampoo or topical azole antifungals, such as ketoconazole creams or lotions. Selenium sulfide works by reducing fungal proliferation and is usually applied to the affected skin for a short duration before washing it off. Topical azoles inhibit fungal cell membrane synthesis and are highly effective for localized disease. However, in cases where the infection is extensive, recurrent, or resistant to topical therapy, oral antifungal medications may be required. Drugs such as itraconazole or other systemic antifungals can be used in these situations. It is important to note that even after successful treatment, skin color changes may persist for several weeks or months because repigmentation takes time. Now let us talk about management and lifestyle measures. Because this condition is strongly associated with sweating and humidity, lifestyle modifications can significantly reduce recurrence. Patients are advised to wear loose, breathable clothing, especially cotton garments, which allow proper ventilation of the skin. Maintaining cool and dry skin conditions is also helpful. This means minimizing excessive sweating whenever possible. Some patients benefit from periodic use of antifungal body washes or shampoos, particularly during warm seasons when recurrence is more common. These preventive strategies help control fungal overgrowth and reduce relapse. Finally, let us review some high-yield reminders and prognosis. First, tinea versicolor is very common and completely benign. Second, an important point often misunderstood by patients is that this condition is not contagious. It results from overgrowth of normal skin flora, not from transmission between individuals. Third, recurrence is extremely common. Studies suggest that recurrence rates can be as high as 80% within 2 years, especially in warm climates. Therefore, maintenance therapy and preventive measures are often recommended. Another key point is that the pigment changes resolve slowly after treatment. This delay should not be mistaken for treatment failure. With proper treatment and preventive care, the prognosis is excellent. To summarize, Tinea versicolor is a superficial fungal infection caused by Malassezia species, characterized by hypopigmented or hyperpigmented scaly patches, commonly on the trunk. Diagnosis is usually clinical, but can be confirmed by Wood's lamp examination and KOH microscopy, showing the classic spaghetti and meatballs appearance. Treatment primarily involves topical antifungals, while oral antifungals are reserved for extensive or recurrent cases. And finally, remember that recurrence is common, but the condition is benign and manageable.